Long COVID is absolutely a reality. It's actually a tragic consequence of this global pandemic. Long COVID is real and long COVID exists, and it's not even a small problem. There's a lot of people in the US and a lot more people globally suffering from long COVID. And there are going to be a lot more if we continue to get people infected and reinfected with COVID-19.
Dr. Ziyad Al-Aly is a clinical epidemiologist at Washington University School of Medicine in St. Louis, and he's the chief of research and development at the Veterans Affairs St. Louis healthcare system. Al-Aly and his colleagues investigated long COVID, focusing studies on symptoms affecting different parts of the body. One of the post-COVID diseases topping the list, diabetes.
We saw very early on in the pandemic that a lot of people, when they get COVID-19, they have this really very high spike in blood sugar. And we started getting reports that people are also having diabetes problems, even kids, insulin-dependent diabetes or diabetes type 1 and diabetes type 2 across all age groups, even in kids. So we decided to take a look. We decided to have a more comprehensive analysis to try to understand, do people with COVID-19 have a higher risk of developing diabetes in the post-acute phase of the disease?
For the study, Al-Aly's research analyzed the de-identified medical records of veterans in the database maintained by the U.S. Department of Veterans Affairs. The study examined the records of more than 180,000 VA patients who tested positive for COVID-19 between March 2020 and September 2021. The records were compared with more than 8 million VA patients who had either not tested positive or received VA medical care in the 2 years before the pandemic. The study found that roughly 2 in 100 people who tested positive for the virus were later diagnosed with diabetes.
It's compellingly clear that infection with SARS-CoV-2 could lead to increased risk of diabetes even up to a year later.
Most had type 2 diabetes rather than type 1.
So in our population, we saw that increased risk of diabetes, mostly type 2, but it doesn't really mean that type 1 is not happening. We see actually quite a bit of diabetes type 1, especially in the kids population, in the children population.
With type 2 diabetes, the pancreas makes insufficient amounts of the hormone insulin, which regulates the movement of sugar in cells. When insulin levels are too low, sugar levels can get too high in the bloodstream, potentially leading to disorders of the circulatory, nervous, and immune systems. Al-Aly believes it may happen when the body's immune system responds to the virus, triggering inflammation that could then impair insulin secretion and sensitivity. And because the study found a heightened risk of diabetes so long after the infection, he said it appears as though little, if any, of the effects may be reversible.
People need to take that into account when they're gambling with their risk every day, going out there with no mask on.
The study found that even mild or asymptomatic SARS-CoV-2 infections increase a person's chance of developing diabetes.
We see a lot of people who are asymptomatic. They didn't even know they had COVID-19. They did not even know they had it.
Dr. Al-Aly recommends that anyone who has been diagnosed with COVID-19 get screened for diabetes. He says an early diagnosis may lead to a better outcome.